Welcome to another incredible Medshield Movement Connect show episode with me, Dr. Fez. And as always, we have brought you somebody very knowledgeable, somebody very well versed in all things health. But today, we're going to be speaking specifically about the skin with dermatologist Dr. Khoza. Get ready to know what you don't know about being body brilliant. This is the Medshield Movement Connect show, where we connect the dots between fitness, health, wellness, nutrition, and of course you. Hosted by me, Dr. N Khoza, and a special guest that we have every month, sharing knowledge, insights, and groundbreaking tips on how to get fitter, be stronger, and live healthier. Turn up the volume and listen close. Today you amplify. It's the Medshield Movement Connect show. Let's go. Dr. Khoza, thank you so much for sitting down with me. I'm very excited because honestly, most of the people who sit here are more about what I want to get out, and everybody at home gets it as a secondary thing.
Yeah. Thank you. Thank you for having me today.
It's always interesting for me because I work with so many different people who've specialized and gone into their own preferred field. As somebody who's a dermatologist, where did that inkling for that specific field come from? And even your story as a medical professional, why did you want to go there?
And it's always so difficult.
Yeah.
I actually just landed in dermatology, or maybe it's the other way around. Maybe dermatology landed on me. But I must say, obviously I went into medical school. And I mean, you would know, we don't do much dermatology during medical school training. But I must have been in my 4th year of study because that's when they introduced the discipline. And I kind of think maybe I was a natural, but anyway, during one of my exams, one of the consultants approached me and just asked me if I ever been interested in the subject. And of course I said, no, I don't know much about it. And then they invited me to join the clinic during school holidays. And they said, we see something in you that we like. We think we kind of have an eye for skin. And if you could join us maybe during your holidays and see if you can maybe build on that. And that's how I got into dermatology. So I started doing, I would say, my rotations in the skin clinic while you were banking. During school holidays, I would go into the skin clinic and I would join them. I did research while I was still in my 5th year of study in dermatology. So when I finished medical school, I knew that I would just go and work, internship, community service, and then go into and become a registrar in the field. So that's how I got in, and that's how I became a dermatologist. I must say the love and the passion is something that I've gained along the way because the skin is a big thing. It's a big thing.
Everybody always likes the largest organ in the body.
But besides being the largest organ, it's a topic of discussion for everything. We always say that skin conditions are psychosocial, political, because everything is about skin color. Our hair is a topic of discussion. So dermatology has become a passion and a purpose for me to say.
I find it very interesting because you say that, and it is an all-encompassing thing. You hear it from the history that we have as a people. I'm not even going to limit it just to the country. But there's also so many things that it means for us as people because we present it to the world. It's that interface. It's what you feel conscious of when you feel like you have something going on your face. You feel like that actually detracts from you. So for you, there's an element of psychology that also comes in there, probably a very big one. And because we see you on social media, and I've gone through and I've perused, and I have to say, sitting next to her, skin is flawless. I love that everything's on brand. But I find that we talk about the psychological elements on these podcasts as well. What have been some of the more jarring experiences you found with patients when it comes to some of the conditions they've had to work through?
It's a lot, and I mean you touch on some of the points that it is your interface. It's how people judge you. It's how you communicate with the world. And now on a medical perspective, we know that skin conditions You know, some of them affect your quality of life. They really, I mean, there's been links between acne, eczema, these are the chronic ones, psoriasis, with anxiety disorders, with depression. And this is not just hearsay. There's been data and research, and we know that those things happen. Body dysmorphic disorders, psychiatric patients who feel better after having, you know, cosmetic operations or cosmetic procedures. So, I mean, on a day-to-day basis, I deal with a lot of pigmented, you know, darker skin tones. And for us, scarring is a big thing. Things like acne that scar permanently. I deal with hair loss, which scars, you know, scars women, you know, a lot. So I get a lot of patients that cry in my office. And typically my consults will start with tears, and, you know, we'll go through all of that. And obviously we end off, you know, with confidence building and just trying to find ways to live with either a chronic condition or scarring or that type of thing. So there's a lot of emotional journey that we go through. There's a lot of psychology, there's a lot of psychiatry. I mean, there's many patients that I've had to refer to a psychiatrist because either it's a neurocutaneous disorder or the psychiatric problem is pushing them. You know, you get something called acne excori. These are patients that pick at their skin all the time. We get conditions called dermatitis attifacta, where patients are fixated on an idea that there's something coming out of their skin and they pick it out. So it's things like that, and being able to merge, you know, science and medicine, skin conditions with the brain and how brain and emotion functions. So yes, I am a psychologist.
And that's what I'm saying. It's such a very complex thing, because I mean, having worked in surgery for extended amounts of time, the nice thing is that you open and you take out. I think that's it's reasonably straightforward. Of course, there's always nuances to everything, but when it comes to things like this that have that social, political, all these other elements, it becomes so much more encompassing.
Yeah.
What have you seen with the adjunct of kind of social media and things like filters and then expectations that are then linked with all of that? Because I mean, I'm sitting here and I might have never seen you in my entire life, 20, 30 years ago, but now I see your skin and I'm like, that's what I want.
That's what you
Come
want.
in with that expectation and I'm like, doc, I'm going to pay you as much as I need to pay you. Make me look like that.
Social media has been great.
Yep.
You know, it's the one thing that has put a spotlight in dermatology. Before, people didn't actually know what dermatology were or what we did. And I think we owe it a lot to social media. But also social media has been really, really dangerous and detrimental to our field, because all of a sudden we have the perfect face, everybody wants to glow. I mean, everybody wants to glow.
I want the glow. I didn't even know what the glow was. I wanted the glow.
Yes, everybody wants to glow. But also I find that it skewed things a bit because people want to look the same, and that's not what we are about. We want you to be unique. We want you to be, you know, look different in your own skin, you know. So yes, everybody wants a pout. Everybody wants a certain jaw that looks squared jaw. Everybody wants high cheeks. So I would say social media has kind of really tipped the scale when it comes to cosmetic surgery and cosmetic dermatology and rejuvenation when it comes to things like Botox, fillers, threads. It's a great learning tool, but then, you know, sometimes that doesn't transpire during consultation because patients, as you say, there's a standard of beauty that has been put out there and everybody wants to fit into that. Whereas if you go back to science, if you look at African beauty versus, you know, Caucasian beauty versus Indian or Asian beauty, we are also different. And when we look at beauty as dermatologists, we actually want to mirror what your natural beauty is. And then you get African women looking for big lips because, I don't know, maybe Fezile appeared with big lips. But big lips don't look great on an African, you know, facial frame. The one that I love is the nose because, I mean, a European nose is always going to be very, you know, and you take that and you transform it into an African face. It looks very, very odd.
Yeah.
So yes, social media has put a spotlight in terms of skincare, and I love that. I love that people are more conscious in terms of what they're doing to their skin. They want to learn more about what we can do to make it better, to make it glow. I love that idea. But I also think that it's also given us a whole lot of people who have body dysmorphic disorders.
Of course. And I think I love the fact that you frame it in that way, because it makes people think, okay, let's optimize rather than let's make you into something you might
not.
think
Yeah.
that you are
Yeah.
and should be, when that is not what you have a
Yeah.
propensity for. But
Yeah.
you also are somebody who knows lasers. And
Yeah.
I mean, as you said, dermatology is not something that was spoken very extensively in medical school, and
training,
unless you
yeah.
were picked as
Yeah.
a prodigy,
Yes.
clearly, then maybe you
Yeah.
wouldn't have ventured in
Yes.
as much outside of the pathological side of
Yeah.
things. So with this kind of adjunct of laser, I've had the benefit of having kind of the Moxie treatment to kind of help with cell turnover and cell renewal. But if you
Yeah.
had to give a layman's term to everybody at home, are lasers good, bad? Can they be beneficial? They sound like they could be something intense when you say laser, Star
I know,
Wars.
yeah.
But what would you say your intro is for somebody who doesn't understand what those are?
So lasers are, I would say, they are these devices, energy-based devices that obviously use light. And light has many uses in the skin. So when we talk about, treatment protocols, we always talk about, especially in dermatology, something that you apply to the skin, and that maybe, let's say you have a rash, you apply it onto the skin and it fixes it. Sometimes you may take medication by mouth. Sometimes you may need, because obviously you're dealing with a layer of the skin, and not everything that you take is going to reach the skin to do what you want it to do. And sometimes creams, you apply it onto the skin, but the skin is such a tough organ that very few things penetrate into the skin. So we use lasers to target a certain layer in the skin. Let's say it's the dermis or it's the hair follicle.
Sure.
And so we use these energy-based devices, almost like, yeah, it is Star Wars kind of.
And that's gonna make
we
it
shine
more
a light
simple, yeah.
beam into the skin. It's all about wave amplification, and then we target whatever it is that we want. And usually we talk about chromophores. Those are our targets. These are either your blood, water, or your pigment cells.
Okay.
And then we can then choose therapeutic wavelengths to treat certain skin conditions. So you can treat things like psoriasis, where topical creams will not penetrate. You can treat eczemas, you can treat conditions like vitiligo. It's a good one for lasers. Because obviously, vitiligo can really scar the psyche, and it's one of those conditions that affect people a lot. So you can now target the actual melanocytes in terms of regeneration. It produces pigment. We can target skin cancers. We can resurface the skin, target wrinkles, and make people look younger. We can target hair if we want to remove hair. For hair removal lasers, or if we are treating hair disorders. So it really is and there's a lot going on in lasers. It's one of those, the sciences, there's new sciences every day, but it's basically like a tool that I think is very useful in the hands of the dermatologist who understands the skin, because now all of a sudden you can penetrate deeper, whereas your creams cannot. And especially, I think now with science, especially for us darker skin tones, most lasers, traditional lasers, were always created for the lighter skin tones. And now with, science and stuff, we're starting to sort of go into wavelengths that can target darker skin tones without causing a burn, without causing injury, which I think is great.
I've definitely, I've had 1 or 2 sessions. It's quite an interesting experience, and I think, you'll hear all sorts of other terms, Fitzpatrick this and all these other things.
Fitzpatrick skin type.
Yes, all these kind of, you see, even for a doctor, it sounds like a lot of information, but it is very beneficial. And I think once that stigma of the fact that it's something that's intense and damaging is taken away, you realize that it can benefit you so immensely. Especially with darker skins, because you might not see those in the more traditional advertisements for it.
Yes.
I have to ask, I feel like I didn't ask this, people at home would be mad at me. Have you always had skin this good? And was that what made you seem like such a prodigy? Because nobody said anything about me being...
No, I've had...
Has it always been this good?
no, I've had acne.
Really?
Yes, I had acne as a teenager.
Okay. No scarring,
Yeah.
clearly.
I don't know. You know, the skin regenerates itself. I mean, if you do nothing to it, it will heal itself as long as you don't tamper too much. And then I had adult onset hormonal acne.
Okay.
So that must have been when I was working.
Sure,
so I have had acne.
Oh, I love this.
And obviously, everybody that goes into dermatology, you come in with a skin condition and you come out flawless.
Looking flawless. So if you had to give me some of the basics, because thankfully I've had the privilege of working with colleagues who kind of give me some tips and pointers. My thing used to be this: put on lotion from head to toe, out. And that was literally me till about 4th, 5th year. And people were like, oh, okay, so no sunscreen. SPF was just a concept I wrote in tests. I didn't think that there was a difference between this skin and that skin. If you had to tell somebody just some 3 to 5 basic things to understand when it comes to routines, and does it need to be 10 routine, like a 10 process thing? Because I see it on YouTube. There'll be 10, 7 active agents, BHA, AHA, element P. So like, what would be some of the key things you'd want somebody to know as an introduction?
Yeah, I think the most important thing is to keep it simple.
Okay.
So it's not a 10-step.
Okay.
It's definitely not a 10-step. I start people with 3 steps in the morning, and I'll say 2 steps in at night. But I think that the most important thing is, yes, there is different skincare routines for the face, and then there's different skincare routines for the body. And I always have to emphasize, don't forget the body. You know, because everybody focuses on the face, and then you actually just focus, you forget to do something as basic as moisturizing your body, which should be done in the morning and at night. Things have become very gentle now. We used to think that it should be harsh, it should sting. If it's stinging, it's working. We should be scrubbing.
This sounds right to me.
You know us. You know, with different cultures have different things. Some people call it loofahs. We used to call it corpo. Some people use the orange sack.
Sack holder. Yeah.
Yes. So that's outdated. We don't do that anymore. We don't. We're not harsh on our skin. We don't use harsh ingredients. We don't like scrubs that are rough anymore. You know, because that we know now damages the skin. It damages what we call the skin barrier, and that leads to problem. So I always say on the face, it's a face wash or a cleanser. It's a moisturizer and a sunscreen. And in order of importance, it's your sunscreen that's the most important, because we live in South Africa.
So what you're saying is just because I'm dark pigmented and dark skinned doesn't mean that I am immune to anything that the sunscreen.
Well, I hope now you know that you need sunscreen.
These are the things I grew up hearing.
I know, and the thing is, they still there. One of the biggest misconceptions is that black people don't need to photoprotect. They don't need to wear sunscreen. And yet I'm saying that the most important product in your skincare routine is photoprotection. So as long as you have a wash and a moisturizer and a sunscreen in the morning, I'm happy. And then in the evening, you have a cleanser or your face wash and a moisturizer, I'm happy. Now, the other things that come, you know, like you saying hyaluronic acid, this and this and this and this and this.
There's a lot of
so remember, when we choose skincare products, we choose skincare products based on skin type. So we don't choose skincare products based on our skin tones. We don't choose because you black, you know, you do this, or we choose on skin types, which are universal. It's combination skin, oily skin, dry skin, sensitive skin, and normal skin. So when you choose products, so that's usually the first thing, you go into the shelf and you find products that are appropriate for you. And those are usually basic. So you find a right wash for, let's say for me, combination skin wash, combination moisturizer, and a combination skin sunscreen. Sunscreen SPF 30 and above for everyone. And sunscreen should be applied every day, whether you're indoors, whether it's hot. It's a 360. It's like brushing your teeth.
I would hope everybody
Yeah.
does. Yes.
So if you brush your teeth every day, you need to apply sunscreen every day. And that's what I teach my patients. Keep it next to your toothbrush so that you remember it's something that you do. So it's SPF 30 and above, and you're good. Now, when you start having problems, you know, not that when you have problems, let's say now you're trying to deal with hyperpigmentation, you're trying to deal with acne, you don't want to age. So that's where the other steps come in. And the other steps are ingredient based.
Sure.
Okay, so you have a wash, a moisturizer, and a sunscreen. And then you'll be like, okay, what else? Then I'll be like, okay, what are you trying to achieve? Let's say if you want to, you say, okay, I just want to glow, or I just want to get rid of my marks. Then I'll say, okay, so here are 2 ingredients that can help you do that. Then I'll say, maybe let's add a vitamin C serum in the morning, or what we call antioxidants. Sure. So these are now antioxidants, are these vitamins that help you fight free radicals, atmospheric aging, and they help you boost, you know, your sunscreens in terms of UV protection. So now that becomes step 4. There's like 4 steps. We're not even like 10
went from 3
steps.
to 4. I mean, hopefully
You know?
it doesn't get to 10.
Yeah.
But I can do 4. I can do 4.
But I mean, can you see now from 10 steps to just 4?
That's manageable.
You know, and then in the evening you say, okay, I don't want to age, pigmentation, nobody wants to age, nobody wants to look dull, you know. So I'll say, okay, another ingredient that you can add in the evening is retinol. I'm sure you hear about retinol everywhere.
Retinol.
So retinol is another power ingredient. We love it because it's so, whether it's acne, whether it's pigment, whether it's fine lines, wrinkles, collagen synthesis, elastin synthesis, it's something that we'll add in an evening step. Sure. So really, if you keep it short, first of all, you choose skincare products on your skin type, and then you choose skincare products or ingredients that are going to basically address your skin needs. You are sorted. 4 steps in the morning and 3 steps in the evening. And we always say, what are you trying to do? You're trying to protect the skin. That's where your sunscreens come in. Yeah. You're trying to prevent, so you want to prevent aging, prevent damage. That's where things like your antioxidants, your retinol come in. And you're trying to basically nourish the skin. That's where your moisturizers come in. Yeah. And it's just basic. The problem comes when you do 10. Then you run into problems.
Listen, I think because I'm somebody who's so zealous and throws themselves at things, I was just like, oh, okay, AHA, BHA, glycolic acid, oh, okay, this, that. And I was literally just being like, okay, you just kind of do.
There's a lot of ingredients that have, especially over the past 2 years with COVID. And I'm happy that people now speak about AHA, GA. I mean, you know, what is the other one? Alpha hydroxy acid.
Thank you, yes.
But it's not like we're not baking here. You know what I mean? It's not like we're adding a teaspoon of AHA. So the thing about skincare is that it's like you have very smart cleansers and smart moisturizers. So these ingredients that we're separating are actually in some of your cleansers, in some of your washes, and in some of your sunscreens now are starting to put antioxidants in them. So it's about just knowing your skin type and just getting advice. Because, I don't go and say I'm applying an AHA now. My wash has those things. My moisturizer has hyaluronic acid. My serums have vitamin C. My sunscreen even has vitamin C in it. It has hyaluronic acid in it. So it's all there, but it's the basic principles that is the most important thing.
Thank you. I mean, listen, I love that is also the case because I've spoken to people. It saves me on my wallet as well. Some of these can be quite pricey, and at least we're not going to go down the route of the other stuff like your niacinamides and everything else, because I feel like we're going to have you back for other episodes to talk about things.
But I mean, that's also
niche.
Great ingredient. That's in your wash, that's in your moisturizer. Are
you impressed by it, by the way, that I said
I'm very impressed that you've gone through your A to Z of your ingredients.
I just wanted you to know that I did my research, you know, always very enthralled by anybody I have here. But before I actually sign out, because all you guys are going to message me, if you had to give me some corner concepts or key concepts when it comes to handling of acne or pimples, furuncles, all of that stuff.
Yeah, acne is a big one, and because it affects most people.
Yes.
So I would say the most important thing, I mean, we spoke about skin type. Most people with acne will have oily or combination skin. So you're looking for products that address the oiliness as well as the actual lesions of acne. So things like salicylic acid, which you find in your cleansers and in some moisturizers. And now sunscreens are also starting to incorporate salicylic acid in them. And then things like ingredients like benzoyl peroxide, which you also find in some cleansers, over-the-counter cleansers, as well as over-the-counter preparations of benzoyl peroxide are also available. So if you have, let's say at home, you want to cleanse with a cleanser with salicylic acid, you want to apply benzoyl peroxide in the morning, and then you want to moisturize, and then you want to apply sunscreen. And the SPF is important because obviously acne leaves a lot of scars, and one of the earliest scars of acne is either redness or it's darkness or like post-inflammatory hyperpigmentation. So your sunscreens are there to sort of prevent the inflammation from the UV radiation, but also to minimize the darkness of the scars. And then in the evening, I always say again, use a same salicylic acid wash. And if you can get a over-the-counter also preparation of a retinoid, there are some available, and that is a very important acne fighting ingredient because you want something that will unclog your pores, you want something that will reduce the bacterial overload in the skin, and then you always close off with a moisturizer because people with acne always think, I'm oily, so I shouldn't moisturize.
Yeah. You wanna be
Whereas
dry.
if you don't moisturize, you actually irritate what we call your skin barrier, and that actually leads to more breakouts. So you must hydrate the skin. It's like a protective step, because the skin only functions when the barrier is optimized. So then it allows it to heal and allows it to function at its optimum best. So my top ingredients for acne are salicylic acid, which you find in your washes, in some of your moisturizers, and in some of your sunscreens. Your benzoyl peroxide, which you find in some washes and in over-the-counter preparations. Your retinoids, which you find in some over-the-counter preparations as well. And niacinamide, my last one,
Just
which you also find
this is
in
multidisciplinary
in
team.
some face washes as well as moisturizers.
Dr. Khoza, before you go, I always ask this of everybody. It's usually a quick fire. Now, when it comes to you, you are an inspirational person. You are somebody who's doing a lot of work and giving information on social media platforms and, I mean, in real world as well. Could you tell me your top 3 people that inspire you or you find that should be inspirational to everybody at home so they can quickly look at them because they want to get more information from people like you? Sorry, don't take too long. Number 1.
Where? On social media?
To you, be it
to
on social
me.
media, whichever platform they can gain information. People at home. Number 1.
Number 1. Well,
Dr. Nkobonga Khoza. Dr. Nkobonga Khoza,
okay.
she's pretty good.
So people that inspire me, let me think, on social media is, let's say, Amanda Dambuza. I like her.
Amanda
very,
Dambuza,
very
I've heard of her,
nice,
yes.
spicy.
Yeah, no, I've heard of her.
A lot of dermatologists. I mean, almost all the dermatologists. I have a
Give me the names.
Dr. Michelle Henry, but she's an American dermatologist. Another one.
Yes, 3. I can't
But
let you go.
everybody inspires me. I mean,
Ooh, that's not true.
I know it's true, but it is true. And I would have to say maybe Professor Khoza, who's my consultant.
I love
and
that
friend.
she remembers where she comes from, and I'm assuming Prof has
Yeah.
probably got as good skin
My
as you
mentor
have.
and
Dr. Khoza, thank you so much for sitting down with me. As I said, the skin is such a, you already mentioned in the beginning, it's such a complex thing to talk about. And I know everybody at home is going to be very interested in how they can build on those steps that you talked about. But I love that you were able to actually get them down to the basics of cleaning, hydrating through moisturizing, and of course the SPF if it's at the beginning of the day to protect against any of the sun's rays and damage. So hopefully you'll come back. To all of you at home, I hope that has connected some dots and you guys can look so glowy, so great, so cool. Until the next episode, it's me, Dr. Fez, going Medshield Movement Connect, show out.